Hello and welcome to a continuation of section 37.3 on regulation of body processes within the endocrine system. So we'll pick up where we left off on hormonal regulation of metabolism, and we're going to start talking about the pancreas. Now you could see a light shadow of the pancreas back here because it is behind the stomach and it's near the duodenum, which is the first part of the small intestines. In fact, the duodenum kind of cradles the head of the pancreas, and then the tail of the pancreas points to the spleen, which would be found right about over here. Now our pancreas is very unique in that it is both an exocrine and endocrine structure. The exocrine function is that it's going to secrete digestive juices, and then we have its endocrine function within the pancreatic islets, or it's also called our islets of Langerhans, and they're going to contain a variety of cell types. We have our alpha cells, which are going to secrete glucagon, and you can see these in the islet over here in the teal color. Then we have our beta cells, which are the light blue color, and those are going to secrete insulin. And lastly, our delta cells, which are going to secrete somatostatin, and we can see that in the green here. And so in this way, we are going to be able to to regulate the digestive processes and also be able to regulate our blood glucose. So we'll start off with insulin, which was secreted by our beta cells. And this is going to be secreted all on its own. It's not under pituitary control. So what we're going to see is that we have some changes in our blood glucose levels. And when we see that our blood glucose is high within the blood, typically after we eat something, especially if it contains a carbohydrate, we are going to secrete insulin from these beta cells. And in that way, we are going to be able to take the glucose from the blood and put it into our cells, especially our liver cells, where we can store it as glycogen. Our muscle cells can also store it as glycogen, and we can utilize the glucose to build protein, and our adipose cells that use the glucose in order to form fat. And then by removing that glucose from the blood, we are able to lower our blood glucose levels. Now, when we have the opposite effect in which we have low blood glucose, maybe it's before we've had our meal, we are going to have the pancreas secrete glucagon into our blood. This travels over to our liver and tells it to promote breakdown of glycogen so that we can utilize those glucose molecules within our blood. It's also going to promote our fat and protein as our energy sources. And our adipose cells can break down fat into its glycerol and fatty acids. Our liver can then take that up and use it as glucose. And through all these different components, we are able to increase our blood glucose level, bringing it back to homeostasis. Now, we have individuals that suffer from diabetes mellitus. This is when we have excess glucose in our blood, and so they continue to rise, and we don't have insulin secreted in order to be able to move glucose into our cells. So we are going to start to see glucose along with water excreted in the urine. And because the diabetics are urinating more frequently, they become very thirsty. And the reason that we carry glucose and water together is because glucose is a solute, and water always wants to go where our solutes are. So naturally, we're going to pull that water toward the glucose that gets left within our blood, that then travels into our kidney tubules and is being excreted as urine. Some other symptoms, you could see them listed over here, are going to be things like fatigue, constant hunger, and weight loss. And our high blood glucose is going to cause an increase in blood pressure because of osmosis, which then can lead to damage of our small capillaries in the kidneys and within our eyes, and that can lead to blindness, which is a consequence of diabetic retinopathy. And we also get some swelling within the lens that affects their vision as well. If diabetes is untreated, it can be serious and even fatal. We start to develop sores that don't heal, that can become severe infections, and can have blood vessel damage that is going to cause kidney failure, nerve destruction, heart attack, or stroke. Let's clarify the different types of diabetes. We have two main types, which is type 1, and sometimes this is called juvenile diabetes or insulin-dependent diabetes mellitus. This is when we are going to not be able to produce insulin from the pancreas, and therefore we don't really have that key to attach to the receptor here, the insulin receptor, to allow the glucose receptor to open up, or glucose channel, I should say, to open up and let the glucose into the cell. In type 2 diabetes, which is also known as adult onset diabetes or non-insulin dependent diabetes mellitus, we are going to see that the pancreas is able to secrete insulin, but the receptors become non-responsive or insensitive to the insulin, and therefore we cannot open this glucose channel to allow glucose to move into the cell. So let's have a focus on type 1 diabetes. We talked about how in this case the pancreas does not produce enough insulin, and we suspect that it is caused by exposure to an environmental agent, most likely a virus, in which we have an autoimmune response that destroys the pancreatic islets that would contain those beta cells to produce the insulin. And our body is going to metabolize fat, which is going to lead to a buildup of ketones within our blood, and that is called ketoacidosis. If you remember this figure that we had previously, let me go back to it. This is referring to this process where we're not utilizing glucose in our cells, so we turn to the adipose tissue that has the triglycerides in it and break it down and utilize the free fatty acids to go through beta oxidation and create acetyl-CoA, which then results in ketone bodies building up that could lead to the ketoacidosis, in which we're going to start to build up acidity of our blood, and that can lead to coma or death. We have to, as type 1 diabetics, inject insulin daily. Our blood sugar is going to swing between hypoglycemia, meaning low blood sugar, and hyperglycemia, meaning high blood sugar. And the symptoms of this will be perspiration or sweating, pale skin, shallow breathing, and anxiety. If we have a problem with hypoglycemia, the treatment is going to be to ingest sugar. And if the problem is hyperglycemia, the treatment is going to be insulin. Now with type 2 diabetes, the patient is often going to be overweight or obese, although not always. And our adipose tissue is going to produce a substance that impairs insulin receptor function. So like we said, that receptor is not working. So even though we have the insulin present, even if it attaches, it will not open the channel here. And we do see more of a prevalence of this in certain families or even specific ethnic groups. That is about 77% more common in African Americans than in non-Hispanic whites. So just to reiterate, our cells are insulin resistant, and what is wonderful is that type 2 diabetes can be prevented or at the very least controlled, and that's by adhering to a special diet and exercising regularly. If that fails, then we can utilize some oral drugs to help regulate blood sugar. Millions of Americans may have type 2 diabetes and not even know it, and the effects of it being untreated are just as serious as those of type 1 diabetes. Next, let's talk about regulation of blood glucose levels by thyroid hormones. So first, let's talk about our thyroid gland, which we're going to find within the neck region. Its job is to regulate the metabolic rate of our body and also has a role in calcium homeostasis, or basically our calcium concentration within our blood. Within the tissue, we have follicles that are going to be filled with our thyroid hormones. And the thyroid hormones that we need to know are triiodothyronine, which is referred to as T3. It's called triiodo because tri means 3, and iodo is referring to the iodine molecule that we see pictured over here. And we can see that we have 3 of them on this molecule. And the other thyroid hormone we need to know is thyroxine, or we also call this tetraiodothyronine, or T4. And this is because it has 3 iodine molecules attached to it, or I should say iodine atoms attached to the molecule. And our thyroid gland is going to have issues if we do not have this iodine within our diet. Our thyroid gland can't produce its thyroid hormones, and if we have low levels of thyroid hormones, we start to increase the secretion of our thyroid stimulating hormone, which is released from the anterior pituitary gland. So we can develop a endemic goiter, which you see pictured over here, where the thyroid enlarges from these increased levels of TSH. Now, when we have our thyroid gland producing properly, our thyroid hormones don't have a specific target organ that it goes to. Rather, it's going to stimulate all of our body cells to be able to metabolize, meaning to be able to carry out its chemical reactions. And the more thyroid hormones we have released, the faster we are going to metabolize, the faster those chemical reactions are going to take place. And if we have issues or abnormalities within secretions of the thyroid gland, at a young age, an infant age, we can develop congenital hypothyroidism, where our thyroid is underdeveloped and therefore we cannot have a proper secretion of our thyroid hormone. In that case, we want to begin thyroid hormone therapy within the first 2 months of life. Otherwise, we will see intellectual disability as a result. The other one condition we have with hypothyroidism in adults is mixed edema. And this is when we have symptoms of lethargy, weight gain, loss of hair, slower pulse, lower body temperature. And so we want to administer thyroid hormones to be able to restore our normal function so we don't have to suffer those symptoms. And more on our thyroid gland, if we swing in the opposite direction and have hyperthyroidism, where we have an excessive amount of thyroid hormone, we can develop an exothalamic goiter. This is when our thyroid is overactive and starts to enlarge and form the goiter. We also see some of the tissues behind the eye really develop and become enlarged, and therefore we can see the eyes protruding out due to that edema building up behind the eye. Symptoms are going to be hyperactivity, nervousness, and irritability, and treatment is surgical removal or destruction of a portion of the thyroid by radioactive iodine. Another function that the thyroid gland has is to help regulate calcium within our blood. And so it can secrete a hormone known as calcitonin, and that is going to be secreted when our blood calcium levels rise. So in this figure here, we can see that demonstrated. Our thyroid gland is going to secrete calcitonin, and what it does is it travels over to our bones and tells it to take up calcium from our blood. And because we're removing the calcium from our blood and putting it into our bone, that lowers our calcium levels in our blood and we are back to homeostasis. We know that calcium is very important in the role of nervous conduction, sending those nerve impulses through, getting our muscles to contract, and also our blood to clot. Now, I mentioned these cells called osteoclasts. Osteoclasts are cells that resorb the bone, so they kind of break the bone apart, and normally they would release calcium into the blood, which would be really useful when we have low blood calcium, but in this case, when calcitonin is released, we reduce the activity of our osteoclasts, so they do not resorb the bone, but instead, we're going to use cells called osteoblasts that will take that calcium and help integrate it into our bone. Now let's talk about some hormonal control of our blood calcium levels. We already talked about calcitonin with our thyroid gland. Now we need to talk about our parathyroid hormone, which is produced by the parathyroid glands. So when we looked at the thyroid gland, we saw that it was a gland on the anterior neck here. But if we were to look behind that thyroid gland in this view, we would find that we have usually 4 little parathyroid glands, although they can vary from 2 to 6 glands. We're going to see that they release the parathyroid hormone in response to low blood calcium. And so we will start to promote that activity of the osteoclasts that we talked about and start removing that calcium from the bones. And in that way, we raise our blood calcium levels. The other thing we can do is activate vitamin D within the intestines so that we can reabsorb calcium in there and put it directly into the blood, and we can also have our kidney resorb calcium as well. And in that way, we raise our blood calcium levels and get it back to homeostasis. And when we are back to homeostasis, we are going to send a negative feedback loop communication to tell the parathyroid glands to stop secreting the parathyroid hormone. Now, sometimes we don't secrete enough of the parathyroid hormone, and that results in hypoparathyroidism. This can cause a dramatic drop in our blood calcium, and then we end up with excessive nerve excitability, where these nerve signals are going to cause something called tetany, meaning that we have continuous muscle contraction taking place. So you could see some of these hand positions that are kind of stuck in place, and without treatment, it could lead to seizures, heart failure, and even death. Now on the opposite end, if we have an excessive secretion of parathyroid hormone, it leads to hyperparathyroidism. And this could cause osteoporosis because we are removing more calcium from the blood, from the bone that then is necessary. And it may also cause kidney stones because of the extra calcium, creating more of that crystallization. Next, let's talk about hormonal regulation of growth. We need to know that our growth hormone is secreted by the anterior pituitary gland. And of course, we first need to get a signal from the hypothalamus in order to do that. So from the hypothalamus, we secrete the growth hormone releasing hormone, which travels to the anterior pituitary gland and tells it to produce and secrete the growth hormone. Now, let's say you're an adult, you're not doing much growing, then your body would secrete the growth hormone inhibiting hormone, and we would not release the growth hormone. But most of the time, especially if we're active, when we sleep, we're going to secrete the releasing hormone and release the growth hormone from the anterior pituitary gland. Now, this growth hormone is also called the somatotrophic hormone, and it's going to promote skeletal and muscular growth. So it travels over to the bones and our muscles and has protein synthesis take place. So we can build that protein within our skeletal muscles and have hypertrophy or an increase in our muscle cell size. Also, our growth hormone will stimulate our insulin-like growth factor, which is produced by the liver, and that can trigger kind of a cascade effect to also increase growth and development within our body. Now, of course, we are growing a lot in our childhood and adolescence, and that's why we're going to have an increase in our growth hormone during those phases of our life. Although if we have too little of the growth hormone in children, this is called pituitary dwarfism, and we end up with a smaller stature. In people who secrete too much growth hormone at a young age, so in children, we're going to see gigantism, where they have a very large stature, but often have other problems taking place because of this. Then if we have too much growth hormone as an adult, this is called acromegaly. And so at this age, because we've already kind of gone through puberty and all of that, our long bone growth is no longer possible, so only the hands and feet and face become overly enlarged. So here are some examples. We can see someone that has an acromegaly hand where the ends of those bones, so if you look at your finger, you can bend it in two places, right? And so where those bones meet is widened here. So we see kind of this buckled out area, and we're going to see a widened forehead. And although this person is not smiling, if they were to, we would also see an enlarged jaw with spaces between their teeth. And we are also going to have enlarged feet.